Good morning, everybody. Welcome again to our update, our COVID update from the county and our municipalities. Thank you for tagging along with us, for some of you for the duration. Some of you for the duration, really appreciate that. Once again, if you've been listening to the news, you've been piped into the positive side of social media, you'll know that we're not looking good. The surge is very real and it's taking its toll on the nation, no less the community. So we're reminding you once again to follow the CDC guidelines. We're asking you once again to adhere to the science and not the fiction, not all those stories that are made up and are circulated and that are appearing as the gospel to some people. But please follow the science. I'm a person that worked in healthcare many years, and I told someone as recently as yesterday, you can shield me all that social media false news, if I may use that term as you want to. I've been raised up around biology and science. I know it's very real, and that's the telltale signs of what's going on. And of course, when you have people who are near and dear to you who pass away, which I've experienced that just over the last few days, and it really touches my heart to have to even say that some friends of mine who were non-vaccinated, one of the couple members passed away from COVID. So I don't need anything else to tell me that it's real. I know that it's real. So I just appeal to you once again from the bottom of my heart to please follow the CDC guidelines. Please consider the vaccination. There are many opportunities for you to get vaccinated. I just heard a report that DPH Public Health has walk-ins. I went into the Super Walmart just the other day. There's a big sign when you first came in that says free vaccines available. So there are ample opportunities for you to get vaccinated if you just would. And that will help us all. We would not be in this place, no doubt in my mind, if we had adhered to that recommendation much sooner. But, today is today, so we can only handle what we have in our hands today. As I say, play the cards you're dealt. So please, ma'am, please, sir, consider vaccination at your very earliest convenience. At this time, we're going to bring back Team Liberty, who's here to address you once again. Coming up front is the very fine mayor of the city of Walthamville, the mayor, Honorable Larry D. Baker.
Thank you, Mr. Chairman. Team Liberty, Mayor Brown, Administrator Joey Brown, thank you so very much. Citizens of Walthamville, thank you to those of you that have taken the vaccination. So those of you that haven't taken the vaccination, it is very important that we do. Like Chairman Levitt said, there's plenty of opportunities. Walmart, City of Walthamville, we had a food drive on last Saturday, and we had vaccination on spot. So, and a lot of the citizens have taken that shot. But please, ma'am, let us continue on. Continue to wash our hands, watch our distance, and wear our face masks. And again, please, ma'am, thank you, citizens of Walthamville. Thank you, Team Liberty, for the information that we've shared among each other. And thank you. At this time, I yield to the floor, Mayor Allen Brown, the City of Hinesville.
Thank you, Mayor Baker. Good morning from the City of Hinesville. I wish I was standing here today with my Allen Brown happy smile on my face, but unfortunately I'm not. Since the onset of the COVID pandemic, we at the City of Hinesville have done our best to follow the guidance of our local, state, and federal health officials. 4 weeks ago, Liberty County's transmission index had increased to over 500 cases per 100,000 residents, after having reached a low of 40 cases, actually a little below 40. Since that time, even, things have dramatically changed in our community. Our most recent numbers show that our transmission index is over the 1,800 mark. That's gigantic. 100 cases is the desired goal. Let me repeat that for you. 100 cases is the desired goal, and we have 1,800 cases as of yesterday. Last month, the City of Hinesville quickly reinstated our face mask requirement in city buildings and facilities once we saw our numbers exceed the 100 cases per 1,000 residents threshold. Currently, we're not accepting applications for assembly permits, which are required for gatherings of 50 people or more in the city limits. Having said that, we continue to monitor the impact of COVID-19 on our community, and we will adjust every meeting if we have to. In fact, our most recent requirement took place at our last council meeting, and we meet tomorrow, and we'll discuss it again, and we'll decide what we do from there. No matter where you stand on this issue, I think we can all agree that an increase this size shows that this thing is not over now, and it's not the time to shrink or shirk the advice of medical and public health officials and relax our mitigation efforts. So we won't. I encourage everyone to take personal safety measures against the coronavirus. Wear your mask, as you always hear, make socially distance. And I think you need to take the vaccine. It's the best way to protect yourself, your family, and our community. The more people who get vaccinated against COVID-19, the better it is for everyone. Labor Day weekend is upon us, and as you make your plans for the holiday, I ask you to remember that you are in the middle of a public health emergency, and to please consider the health, well-being, and safety of not only you and your family, but our entire community. If you choose to gather together, please do so in ways that promote the health of everyone involved, and please educate yourself from primary and trustworthy sources of information. Please continue to practice the 3 W's, and please get vaccinated. Thank you.
Thank you, Mayor. I just want to touch on a few numbers here and then update you on what the county's position is on some things. The mayor mentioned our transmission index. As of yesterday, it was at 1838. When we talked to you last on August the 4th, it was 651. So it's doubled since that time that we gave our last report. Our 7-day rolling average as of yesterday was 109. Again, when we talked to you on August 4th, it was 35. So that's more than tripled. Our hospitalizations, basically just like all hospitalizations in the region and in the state, are over the top. All non-emergency surgeries have been canceled, and those surgical areas have been converted to bed areas where they are full at Liberty Regional right now. As of a few minutes ago, Liberty Regional has a total inpatient count of 38. Really a capacity of in-bed patients of around 25. We did have 17 patients that are in the emergency department, basically waiting in space there for a space to come open. We did have 13 ventilators in use as of this morning. We did request over the last week extra ventilators from the state. We received a couple of those, but even with the new ventilators, staffing is still an issue. There have been staff that have been affected by COVID, obviously, like have been in a lot of functionary areas. So getting more beds or getting more ventilators does not necessarily mean there's staff there to take care of those. Basically, needs as they are addressed by the hospital are an emergency nature through our ESF 8 function, which is the health function that comes through EMA. Those are put into a EMA request site to the state on a resource request and then acted upon by the state. Just like you're hearing in the national statistics, 98% of those patients hospitalized for COVID are non-vaccinated. 98% at Liberty Regional non-vaccinated that are in patients for COVID. Last week, we were forced to put out an emergency notice concerning emergency calls. 911 and EMS beginning an inordinate amount of non-emergency calls. And to that end, we did have a period of time last week where we had an extended period of time to be able to answer EMS calls. I want to stress, and I just really can't stress it enough, please don't tie up these folks for non-emergency calls. Now, that being said, if you're experiencing chest pain, shortness of breath, stroke-like symptoms or obviously trauma of some type, that is what you need to call 911 and EMS for. But we are having a lot of calls that take away our EMS crews. So what happens when you call an EMS unit to go to the hospital? Basically, they're going to assess you. If you are transported to the hospital, that doesn't necessarily mean that you're going to hop above somebody else that is already waiting there in some of those crowded waiting areas just because you came by EMS. Basically, the hospital will also do an assessment to determine the nature of your injury, the nature of your call, and the rapidity that you need to have on being looked at that facility. So again, please just reserve EMS and 911 for true emergencies. EMS units, when they get to the hospital, because it is so packed, are unable to leave patients at the hospital because there are no beds or stretchers open. And so our EMS crews experience what's called wall time or wait time that keeps them tied up on possibly non-emergent type calls at those facilities, and then they can't get back out on the road for emergencies. So you need to understand how that affects you potentially, and certainly how it's affecting our hospital staff and our EMS staff. All hospitals in the area are full. They've been on diversion. I think Ms. Mims said in a call we had a little while ago, there have been a few beds that come open every now and again, and then of course then they have to transfer folks out of that facility to a waiting facility. Last week, the commission, because of the increase in COVID numbers, had to scale back recreational offerings. There is a notice posted on our website about that. So until further notice, this was effective actually August 30th. The suspension of activities at the rec includes all programmed activities in league play. It did affect, as of now, the rental of pavilion areas and congregation of folks in those facilities. Do want to stress, though, this does not affect any non-organized use of public spaces, which include, among others, walking trails, playgrounds, and outdoor basketball courts. So continue to enjoy the outside activities as of right now with everything that's going on. Our buildings and entry here continue to be monitored for masking, very strictly monitored now for masking and temperature requirements. We ask you to just be patient as you come in and get screened at these locations, and please understand that we're trying to protect you and protect our workers. We have been affected in the staff throughout the county from place to place, and have people on quarantine, have had them come back, and so please just understand what we're going through there. At this time, county commission meetings are still open to the public. We will be practicing distancing guidelines in there, so we ask that if you have a matter on the agenda that you finish your agenda item and please exit the room so others can address their issues that are there. Statewide, on the vaccination rates right now, our statewide vaccination rate as of yesterday was 51% with 2 vaccinations, are fully vaccinated, and 43 with 1 dose. In Liberty, those numbers are sad. 28% have been fully vaccinated, and 24% have had 1 vaccination. Again, and I know you see this, and Chairman Lovett addressed the science and addressed the truth and some of those things. I know after we spoke last time, it was fake news we were reporting. Just look at it for yourself. Don't distrust our numbers. If you want to, you can see those on the web. 98% of the folks that have to go to the hospital are unvaccinated. We need to really try to tackle that. Information on vaccines and testing continues to be available at the Georgia Coastal Public Health site. That's covid19.gachd.org/vaccine. The Coastal Health District is lining up to do some testing by private providers beginning September 13th from 8:30 in the morning to 1:30 in the afternoon at the Schumann Center at 800B Tupelo Trail in Hinesville. So again, appreciate the opportunity to come give you that status update. Please be safe, and I would ask that you please pray for those that have been affected. Pray especially hard for our hospital staff and those folks that are in there in the trenches working along with our emergency crews. Thank you.
Thank you once again, Team Liberty, for your updates. I know that the public will appreciate what we're trying to do to get information out to them. Very recently in an email, one of the commissioners asked, what can we do to help to combat the surge? And my question was, what can we do that we are not already doing? I mentioned earlier that the Walmarts and the walk-in at the health department, all those churches are giving vaccinations. What else? What can we do we're not doing, to help the public to better embrace and to consider and to take the vaccine? So it's very frustrating. Then, speaking on behalf of the healthcare workers, they are tired, man. They are just tired. Not just healthcare, but all public safety. I mean, that's fire, police, everybody who has to come to your rescue. They are tired. We thought we had reached that period where we were going to be able to relax some and put these things aside, and here we are again, maybe getting ready for a booster. So I want to let you know that it's not just about you when you refuse to be vaccinated or to take the precautions. You're affecting a lot of people who have families, who have lives, who are tired of working 14 days in a row, those kind of things, when most of you are just doing the 5 days in a row. So please know, don't be selfish. It's not just about you. It's about everybody who we come in contact with. So give serious consideration to all the opportunities that are available to be vaccinated. Give serious considerations to wearing your mask and watching your distance and washing your hands. Give serious consideration to social distancing. Give serious consideration to your neighbors, your family, and your friends. I don't know anybody right now who doesn't know someone who has either been sick with COVID or who has passed away with COVID. And when I get these phone calls on sometimes 3 times a week basis, it's a lot of wear and tear on us emotionally. So I beg of you, I really do, I beg of you to please take this seriously. Let us go out today and do whatever it is that we can to help combat the surge of COVID in our community. And when Joey mentioned the 22%, was that what it was, 28%? Man, I can't say Liberty County proud behind that. That's not who we are as a community. So let's make that better starting today. So please go to the website, look at our Facebook page, go to the City of Hinesville website and Facebook page, go wherever the information, and it's out there. It really is out there. Did you get information you need that you would seriously consider that you would do what's best for you, your neighbor, and your friends? Thank you so much. We see you at our next update. In the meantime, don't forget, wear your mask, wash your hands, watch your distance. Thank you. Have a good day.